Hey everybody, in today's episode we talk to Kim Rittenhouse. She is the owner of Hope Hill Mental Wellness Center in South Parkersburg. She is a nurse practitioner and she owns and operates the practice there. And we talked to her about her background. We talked to her about the services that her practice provides for her clients. And this is actually going to be the beginning of a series we're going to do with her and her staff on mental health in the Mid-Ohio Valley. So I hope you enjoy. Kim, tell me about your background and your journey as a medical professional and what led you to opening Hope Hill Mental Wellness Center.
Well, I started out as an LPN about 30 years ago and stayed as an LPN for about 19 years. And then an opportunity came up for me to go from LPN to a bachelor's through a school, and the employer that I was working for at that time said, sure, do it, that would be a great opportunity. So I went through it, loved schooling. I thought, I think I can do this. And then so I went and did that, and then I thought, well, I'm not going to stop. So then I went a little bit further. There was another program that came up that you could go from bachelor's to nurse practitioner. So I jumped right on that and went to West Virginia Wesleyan for a while, and then I went to Shenandoah University out of Virginia, where most of that was online, but we did have some travel and some long weekends down there. It was a great program, learned a lot, and I kind of sailed through it pretty easy and just thought this is the thing for me.
So, and then you've recently opened this clinic, which is called Hope Hill Mental Wellness Center. Tell me how that kind of came to be, and then what all do you offer here?
Okay. There was just such a need in the community for another place to open up. So I felt like I wanted to help the community a little bit more, have a little more autonomy in how I wanted to run the practice. We are very patient-centered, very patient-oriented. We're not very rigid on our hours or our times that we see the patients. If somebody calls and says that they need to talk to me or they need in, they come right in. We take care of them, because when you have a mental health issue, whether your depression's getting worse or anxiety and the walls are closing in, you can't wait 3 or 4 days to see somebody. So you need to see somebody right now. So we like to get them in here. If they call and say that they need to come in, come right in, and we take care of them. They're evaluated. If they need to go to the emergency room for an admittance, then we would suggest that. Or maybe it's something that they just need a little bit more reassuring on their medicine. Maybe they just started something. People with anxiety, they have a lot of issues with starting a medication. So that's how this came about. I wanted to see what it was like to own my own business, and I just wanted to have more control in how people were taken care of. So what we offer here is we offer medication management. We also offer therapy. We're going to be doing Suboxone. We also offer TMS, which is transcranial magnetic stimulation, which is a procedure on the brain. And then we have some other things coming up also in the future that we want to do. We don't want to stay inside of the box. There are so many more options out there other than medications. People they want help, but they're a little bit hesitant on putting a chemical in their body. So there's other ways to take care of that. And there's been a lot of research done that shows that people with even just a little bit of mental health issues, they don't take care of themselves very good. They sometimes can't leave their house, and they just can't take care of themselves. So we're also offering a family nurse practitioner here. So where the patients come in, they feel comfortable with our staff, which they are absolutely wonderful. You're greeted as soon as you walk in the door every time. And they can get their family health taken care of right here too. So we just don't stop with the brain. We go completely from head to toe with taking care of them. And if it's something that we can't do here, we'll make sure that we follow up on a referral to get them to somebody that needs to take care of their needs. One of the things, and I know everybody can't see this, but our office is not sterile, it's not ugly. It's made to make the person, as soon as they walk in the door, feel very comfortable, very loved, very welcomed. They are not a problem to us. They are, the reason why we're here.
What made you want to become a psych nurse practitioner?
Well, I worked in the medical field for about 17 years, worked in a family practice. And mental health in that practice was not taken care of or addressed as a serious issue. Mm-hmm. So there was one patient in particular that she didn't get the attention that she needed to her mental health. So she had depression, she had anxiety, she had fatigue. So she didn't want to get out, didn't want to exercise, didn't want to do anything, and just wasn't given good mental health advice at all. So by her depression and anxiety not being addressed, she ended up gaining a bunch of weight, just laying on the couch. She ended up with hypertension, diabetes, heart disease, because had her, depression and stuff been addressed correctly, she should have
prevented.
Yeah, this could have been prevented by getting out and exercising and, feeling like you have worth and purpose and that you're not a problem to the practitioner, that's seeing you or anything. And there's already such a stigma on that anyhow. And so that was one of the things that I wanted to get into this field for. The other one was a little bit closer to home. A person that I know had very severe mental health issues and had tried to commit suicide most of her life. And her children even had to walk in and find her almost dead. And she wasn't really taken serious. She was just kind of passed around. Even though she was very specific in how she wanted to complete suicide, she still was not committed. And so that bothered me. So about a month later, after they had did a mental health evaluation where they were trying to get her committed into the behavioral health unit, how they had told the person that did the eval that this is what she wants. They showed them text messages and things like that, and they said that she wasn't bad enough she wasn't going to do it. 1 month later, she completed it exactly how she said she was going to do that. So that rocked me. That really did. And so people that have mental health issues are, their providers leave a lot of times. It's hard to keep a therapist. And so it's just once that person comes in and you hear their story and the trauma that they've had, you're not usually going to find a mean person. Mm-hmm. But if you know their background and know as sometimes, often, as a child, you're just so vulnerable. And so when you're taken advantage of and traumatized, sexually abused, physically abused, told all your life you'll never amount to anything, and then you go and you tell that provider that's the provider that you think that you're going to have the rest of your life. Mm-hmm. So that's one of the things why I opened up my own practice, is because I wanted to prove to people I'm not leaving, I'm not going anywhere, I'm grounded in this area. We've made it so that they can wheel me in a wheelchair and I will still be here with them. I'm in it for the long haul because they're just tossed around so much, and I just feel like they need a stable environment.
So how long have you been a psych nurse practitioner?
4 years. 4 years this month, and I absolutely love it. I can never see myself doing anything else. This is my passion, my heart, and I love everybody that I see. I mean, truly love them. They are awesome.
Do you rely a lot on your formal training, or do you learn a lot as you go?
The formal training is good. They give you very good parameters to stay in. But I'm finding that each person is individual. Just like our thumbprints and fingerprints, everybody is individual. So it gives you a good place to start, but each person has to be dealt with individually because genetically they're different. Their background is different from some that have trauma, some that do not have trauma, some that grow up in a home where they see all this depression. So when you talk to somebody and you get that initial psych history, which should take you minimum of an hour to get, minimum. Once you see that, you can see how it runs right down a family tree. It'll either be both sides, or it'll be one on a really, one side of the family, very, very strong. And it's like, how can you not have this? Everybody has choices, but sometimes you're just already pre-genetically disposed to being an alcoholic or an addict or having depression, schizophrenia, bipolar. Some of those things you just can't help.
There's a stigma around mental health and taking medicine. Why do you think that is?
Well, I think this goes way, way back to the mental hospitals, like the one in Weston and stuff. If you look on their website and you look at different reasons why people could be committed to a mental hospital, some of them, were just totally, you just laugh about it, but it actually was a thing at that time. And so now when you're any kind of depression or you're called crazy or anxiety or anything like that, and you're taking a pill, well, number one, you're completely unstable, which is not true. Or you're going to go shoot someone up, and that's not true. So to be on a medication that alters, and tries to fix those chemicals in your brain, serotonin, dopamine, and norepinephrine, people look down on that, and I think it starts way back from there. Hollywood has portrayed people as, somebody that you don't want to be around or somebody who's homeless or something like that, when in fact that's not the case at all. We don't get onto a diabetic for taking their medications, right, and it's still an organ. We don't get onto people who, take medication for their lungs or their stomach.
It's an actual illness.
It is. And like I said before, genetically, a lot of times you're predisposed to it. You have grandma, aunts, uncles, mom that have all suffered with depression, and now here you are. And you've seen maybe how they've dealt with their depression, most of their lives, which hasn't maybe been good. And you see mom maybe doing some bad decisions with maybe being, having different men in. This is just, one scenario. Or always just laying on the couch, not being able to do anything, not being able to focus on the family. So you see that and you're like, am I going to end up like that? And so a lot of them, they're scared of that. And then like, okay, if I say I might need medication or therapy, is that giving in? Or is that giving up? No, that's the start of getting better.
Some people believe that medicine numbs you from all emotion. Is that true, or is it different for everybody? Does it depend on the dosage?
Yeah, it depends on the person, it depends on the medication, and it does depend on the dosage. If you're taking a medication that numbs you, then you shouldn't be on it. Okay. You're on the wrong medication. I actually just had a person in here the other day who came in and she's like, I don't care about anything. I don't care. And I'm like, well, we can't have that because that's not living. That's not how life is. When you take something for mental health, if you're on the right medication and you have the right therapist, this should make you a better you. Yeah. You should still be able to make very good decisions, be able to go out in public, be able to have fun and laugh when things are funny and cry when things are sad. You can't blunt people because that's not living. So what I do here is I have people come back often because I care about them. Mm-hmm. And every 2 weeks, and I don't bring them back every 2 weeks a lot of times, but, every couple weeks you should just make a phone call. How are you doing today? Because they can spiral downhill with one phone call. Yeah. But if they're taking something and they feel numb or they're just sitting around and not doing anything, then that medication needs to be changed. If you're taking something for mental health, you really shouldn't even know you're taking it. Mm-hmm. People around you shouldn't say, oh, they're just, their personality's gone. Then they're on the wrong medicine.
Yeah, people have talked to me before and they don't want to take medicine because they just believe that it takes away all your emotions, and that's not true.
Right. And that's where they've seen maybe mom, dad, an uncle or aunt, brother and sister go and see multiple providers. I mean, it's nothing by the time I get somebody here that they've been to all the different centers around here in town. And not that the centers have done anything wrong, but maybe they just haven't given them the right medication, and these people are desperate for help. They don't want to lay around, and they don't want to miss out on outings with their families. They don't want to. This is something that they can't help. Now, you do have some people that will never get better because they don't want to.
Yeah.
Those you can't help. You know, and you know that, but you still love them and you try. But for the most part, people want to feel better. They want to go and have a picnic with their family. And I hear that so much. I just want to enjoy watching my child play ball. And they can't.
Let me see if I can word this correctly. Talk to me about how important it is to be emotionally aware or have emotional intelligence.
That's extremely important, to be aware of your emotions. If you are starting on a medication, a lot of times when patients come in, nobody comes in here happy. Everybody's searching for something that helps. And is there a magic pill? Yes, sometimes actually there is. And so I encourage patients to bring in their family members so that I can get the perspective from the parent or the spouse on how they're doing. It's not uncommon for someone to come in and sit down and be a little bit discouraged. You know, nothing's changed. I'm the same as I was. I'm like, really? Now there has to be something. And they'll be like, no, I still don't feel good. But then the parent or the spouse will say, well, you're smiling more and you're spending more time with us. So it's very important for the whole family as a unit to be involved in that and to be aware of your emotions. Like, are you getting too upset over something little, or was this really that big of a deal where you had to have a meltdown and your fists go through a wall or something? There's a problem if that happens. But if you've been like that for years and not been treated correctly, that's your way of learning or your way of living.
You should know what triggers you and what doesn't.
Right, and so that's where therapy comes in as 50% of the help that somebody needs. So your brain is kind of trained that nothing is good, nothing's ever going to be good. So you have to just keep encouraging people and talk to them about changing that kind of stinking thinking.
So right away when you meet someone and ask, how are you, can you see symptoms immediately?
Yeah, you can. On that first time coming in, people are very nervous. They usually complain about the amount of paperwork that they have to do. So there's some kind of complaint about something a lot of times, or there's too many people out there, or it was too loud or something. So here we try to keep the TV down to a minimum, chatter down to a minimum. But yeah, you're going to hear laughing here because we have a great time. We love our people, and the girls out front, sometimes they'll paint their toes or something. So it's a very relaxed atmosphere here. And but when they come in, you can see some of the things that they do. They'll be sitting, maybe someone with anxiety is usually up like this and right on my desk, 2 feet away from me. Then the next time when they come in, they're kind of sitting back like how I am right now. Yeah, I'm feeling a little bit better. Yeah, and telling somebody your deepest, darkest secrets, that's tremendous. And they have to have a lot of trust. So you want to mirror yourself to that person. If they come in upbeat, then you are upbeat. If they come in down, you don't want to be upbeat and perky because that's going to intimidate them and then remind them of how they don't feel. So you have to mirror how that person is. So you really watch their mannerisms, their body language, and things like that.
Okay. Has mental health changed over the years as far as what you see and how it's treated?
Yeah, I do. I think, finally people are starting to take it a little more serious. Medications that have come out now are having less side effects. And some of the side effects, and these are traumatic. Some of the side effects with some of the older medications is weight gain, foggy brain, sexual side effects, things like that. So if you have somebody who comes in and they're depressed, and then you put them on a medication that causes them to gain 40 to 50 pounds, and some of that you've just really, yes, they're feeling better, but now we've created hypertension, diabetes, heart disease, and low self-esteem. So the newer medications aren't doing that as much. I mean, you can really monitor those, watch their blood work and things like that. So it is changing, and it's all for the better.
Let me ask one question before we wrap up. When you approach a new client or even any client, I mean, are there similar processes or strategies you use on everybody, or do you have to kind of customize things with everybody?
It's customizable with every single person because the history is different, the trauma is different. The kids, kids you wouldn't think about hearing how bad their life is, but you have to just tailor it to every single person. Like I say, mirroring how you would, mirror and talk to that person the first time. You watch their body language, see how they're doing, if they're like into it, or if they're here because somebody said they needed a medication. Now, I've had several people that come in and they know that they're being sent here for medication management, but yet I have to talk them into taking a pill.
Yeah.
So I have to do a lot of convincing that trust me, mm-hmm. I know what I'm doing, and I really I care about you because I take it personal. Mm-hmm. If somebody doesn't do well, that bothers me because they have hired me to help them feel better. Mm-hmm. And sometimes that's giving them a medication. Sometimes that's saying you have to go to therapy. Sometimes it's saying, hey, you've got to get out of this situation, that there's not enough medication to make this situation okay. So you have to be sensitive to, can they leave their husband or wife, or can they leave this job that pays well but yet is causing them ulcers and not sleeping at night. So you have to just be customizable to every single person.
Well, Kim, I appreciate the time you've given us today to talk about some of these things. And as we've discussed off camera, we're definitely going to come back and probably on a regular basis.
Cool.
Go a little more narrow on some specific issues and specific things that affect people and things that you guys do around here. So I appreciate your time.
Thank you so much.
Thank you for watching this video. Please subscribe or follow us for more videos like this.